Hi guys, we are going to go through a shoulder evaluation, and what we'll typically start with is a functional movement assessment. Whether you use the SFMA or the FMS, it's going to depend on whether your patient is presenting with pain or not. Christy is actually presenting pain in her left shoulder. That's all we know about it so far, so we're going to go figure out what's going on with her shoulder. So, Christy, can I have you slide your shoes off for me? With the SFMA, we always do everything with shoes off. It just establishes a baseline and creates some continual, measurable results. Turn and face that direction for me. Feet together. And I'm going to take Christy through just a few of the baseline top tier assessments from the SFMA. So can I have you put this hand behind your head like so and touch opposite shoulder? Great. And switch. Good. Was there any pain or dysfunction with any of that?
No.
Okay. Can we bring your right hand behind and touch opposite shoulder blade like so? Good. And switch. So off the bat, both of Christy's shoulder blades wing off of her thoracic cage just a little bit. Does that cause any discomfort? Okay, so not painful, but still clinically relevant to what we have going on with her. Go ahead and drop hand. Let's look up at the ceiling as far as you can. Good. And ideally we would see her forehead be parallel with the ceiling. We're just shy of that. Tuck chin down to sternum. And ideally the chin would touch the sternum as well. We're just shy of that. So this is indicating that she has some degree of upper thoracic spine dysfunction. Turn head as far as you can to the right. Good. And to the left. Excellent. She did that quite well. Her cervical range of motion is adequate. So now we have something going on in thoracic spine, something going on with scapular stability. We're going to break some of these patterns out real briefly, and then we're going to dive into some orthopedic assessment to figure out exactly what tissue we're working with. So Christy, can I have you on the table facing that direction on your hands and knees? Good. Sit all the way back on your back, and then elbows down in front of your knees on the table. Let's put your right hand behind neck. Elbow to the sky, and rotate upwards as far as you can. Good, relax there. Excellent. We're going to switch, bring this arm down to your low back. So right hand to low back, excuse me. There you go. And let's rotate upwards again. Good. Actively and passively, Christy cannot achieve 50 degrees of rotation. So we have some issues from her T-spine down into her lumbar spine. Let's go ahead and switch. Elbow to the sky and rotate. Same thing here. Any pain in the shoulder with that, Christy?
No.
Okay. Bring this hand down to your low back and rotate up. Okay. Excellent. Go ahead and relax there, and then have a seat and come around the table for me and face this direction. So, as of now, we have a thoracic spine extension problem. We have a thoracolumbar spine rotational issue. And now we're going to go after and figure out what the tissue of origin is. So we figured out our why Christy's shoulder might be hurting. Now we're going to figure out what exactly that is. So let's bring both of your hands up just like so. And then just relax there. Meet my resistance here. Does this cause any pain?
No.
Good. And her strength is adequate. She meets my resistance. Let's go ahead and come across with the right hand. Bring right elbow up. Good. Does that cause any discomfort?
No.
Excellent. Let's bring this hand across. And does this cause any discomfort?
Yes.
Okay. So this could suggest a couple of things. This is working obviously with the AC joint. We could have some subacromial impingement going on. We could also have some AC joint dysfunction going on. So we're going to investigate just a little further. Let's bring hands like so. We're going to externally rotate against my hands. Good. Does that cause any discomfort?
Yes.
Okay. In the same location?
Yeah.
Okay, so now we have one of our rotator cuff muscles, the infraspinatus, involved. Let's squeeze together. Any discomfort here?
No.
Awesome. Hands on both hips. We're going to pull right elbow back, push right elbow forward, note what that feels like, and we're going to compare. Pull left elbow back, left elbow forward. Any pain with that?
No.
Excellent. Let's come here again, and I just want you to put thumbs up and come all the way together. Does that cause any discomfort?
No.
Okay. And then thumbs here and all the way up. Excellent. Good. No issues there? Okay. So we're going to go back to the fact that Christy's shoulder blade was a little unstable in the Apley's or shoulder pattern 1 and 2 test. So can you go back on hands and knees on top of the table? This is called the quad rock pattern. This is a great shoulder stability exam. So we're just going to kind of rock you back and forth. Just let me go with the flow. So in this plane, Christy's shoulder blades seem relatively stable. We are getting a little bit of winging on the superior angle of the scapula here. So now we're going to rock fore and aft. So come back and forth. And so far right now, Christy's doing a pretty decent job of keeping everything together. Can you go long into a push-up position for me on the table? Good. Same thing, now we're going to rock back and forth. This shows a little bit more scapular instability, and then let's rock fore and aft. And again, getting more of that winging specifically on this left-hand side. You can come on down. So, in conclusion of our examination, Christy has some spinal dysfunction. She has lack of thoracic spine extension. She has lack of thoracolumbar rotation. This is causing or being caused by some scapular instability, and I believe she is suffering from scapular dyskinesis with a little bit of subacromial impingement in her left shoulder. There's lots of ways to treat this. Obviously, as chiropractors, we're going to go after the low-hanging fruit, and we're going to adjust Christy's upper back and her thoracolumbar junction to get better extension to allow that shoulder blade to appropriate on the rib cage. We're probably going to go after some soft tissue dysfunction in those rotator cuff muscles, and then we're also going to help her stabilize that scapula and rehab the rotator cuff as appropriate. Thanks for having me, guys. I hope you've enjoyed it, and hope this helped you out in your clinical journey.